So let us move on to the final question. So it is from Rekha, and it is about PCOD. So what she want to know is, what are the common symptoms of PCOD? Can PCOD affect teenagers, or is it only seen in adults? And you want to know, what are the treatment options available?
Wonderful. So polycystic ovarian syndrome or polycystic ovarian disease, it can affect teens and adults. Common symptoms include irregular periods, excessive hair growth, acne, and weight gain. Again, in the past, we thought that polycystic ovarian disease patients always usually are overweight, but that is not true. Even people who are leaner can develop polycystic ovarian disease. These are usually due to excess male hormones, irregular periods, or very light periods. It can lead to irregular ovulation or sometimes even infertility. Excess hair growth, again caused by androgens, hair growth in areas like face, chest, back, and abdomen. Acne it can worsen or it can trigger it, particularly on the face, chest, and back. Weight gain is also associated with, especially around the abdomen, as we discussed before. But hair thinning can be seen on the head, patches of dark, thickened skin on the neck or armpits, suggestive of insulin resistance. We can have skin tags. Polycystic ovarian disease symptoms can become, unfortunately, troublesome for some of the teenagers. Even in earlier cases, sometimes may need to start, we call it as birth control pills, or to regulate their menstrual cycles. But unfortunately, there is no certain set treatment for polycystic ovarian disease, but we individually assess each symptom. Like, again, there is a medication called spironolactone that we prescribe for people who have problems with excessive hair growth. If it is because of, if they are having trouble with weight gain, we give them the newer medications like GLP-1 analogs. We call this the Semaglutide or Liraglutide or Tirzepatide to help them with weight loss. It is important to note that people with polycystic ovarian disease do develop diabetes in the future. It is very, very crucial to address it at the earlier stages. They can also develop heart disease. They can also develop a condition called as obstructive sleep apnea. So it is very, very important to address it at the earlier stages and start treatment early, seek a specialist help.
Thank you, doctor, for shedding light on that. So it seems it is not only affecting the ovary, it is having multiple symptoms and multiple parts of the body is affected by that.
Yes, it's a multi-system disease. It's not very well recognized. We are learning more and more about it, those conditions. Like I said, there is not a particular treatment because it's a syndrome. There is no one test that can diagnose polycystic ovarian disease. It can be difficult to diagnose, and there are a lot of stigma around the disease, but it is treatable with certain small changes that what we just described.